Hello, welcome to NCE, Study for the NCE 5-minute videos. Today we're going to be covering clinical focus, and we are in subheading AA, religious values conflict. So this is I guess in the general term, the ACA has an association for spiritual, ethical, and religious values and counseling. And in this division, they are kind of look at the spiritual, ethical, and religious values in someone's overall development. Through the counseling process. And what this division has looked at are some of the barriers to mental health because of religious or spiritual practices. So basically, when a counselor has their own religious or spiritual beliefs, and the patient has very different spiritual or religious beliefs, then that can get in the way of the counseling, the kind of the mental health outcomes, because a lot of times that therapeutic alliance gets broken or isn't as strong as maybe it could be, and that kind of creates what we call barriers to outcomes or to treatment. Many counselors are not comfortable addressing issues of faith, and that's a problem, because the lack of comfort creates a lack of competence, and that kind of reflects on some of the outcomes. Other things to consider when religious values conflict is that the clinician is the professional. So really, the burden or those conflicts fall on the clinician, as far as putting their personal views or putting their personal faith as one thing, and then putting themselves in a professional setting. So according to the ACA Code of Ethics, we need to be working on ourselves, and that includes non-judgmental and not forcing clients into certain beliefs. So part of that is the notion of active listening, which should be part of those core conditions. The other thing is thinking, right? Being empathetic, going back to Carl Rogers in core conditions, and then clarifying, asking, what does that look like? How do those beliefs, spiritual, religious beliefs, intersect with their mental health? Because again, they're coming to you for a reason, and those beliefs do have to have an understanding, so that one can get a better sense of what their world looks like and how those beliefs are shaped. So understanding perspectives, being open to ideas that are much different than personal ideas, and then thinking upon those in a respectful manner. That's how you create those therapeutic alliances, and also that's how you grow as a professional clinician, so that you are able to see things from a different perspective, and even if personally you may not agree with it, or personally you may think that's not correct, that's okay to have that personal opinion. But I think the most important ingredient is looking at what that conflict between counseling and religious or spirituality looks like, and then how to address the mental health without the judgment. So those are just some things to keep in mind when talking about religious or spirituality practices.